My name is Dr. Matthew Weir. I'm a professor of medicine and chief of the Division of Nephrology at the University of Maryland School of Medicine in Baltimore.
How long have you been practicing nephrology?
I've been practicing nephrology for many years. In this coming July, I'll have been at the University of Maryland School of Medicine for 35 years.
What made you want to specialize in nephrology?
In large part, I went into the study of kidney diseases, and predominantly probably at the beginning, because I loved critical care medicine, and these were often the sickest patients, and I had an opportunity to really step in and manage them with their multiple medical problems as well as their kidney disease in an effort to again assist them in recovering. Subsequently, with more training, I realized I enjoyed kidney transplantation, where you really had a chance to fix people, and you could see the impact of a kidney in terms of restoring vitality, longevity, and quality of life.
What's your relationship with the Home Dialysis of Maryland?
My relationship with the Home Dialysis of Maryland is as serving as their chief medical director. I assist the staff in the supervision of all of the patients. I help in terms of addressing issues about process, quality of care, and again, improving patient experience and patient-reported outcomes.
Hold on one sec. Just want to
Is that pretty good, John, in terms
Excellent.
This is
great.
fabulous. Monitor
Natural.
echoes. Go ahead.
What made you accept the role with Home Dialysis of Maryland?
Well, it was really a growth opportunity for me. I've been doing dialysis for many years. I had heard a lot about home dialysis and the opportunities for it to assist in better management of volume, blood pressure, management of acid-base and electrolyte abnormalities, as well as improving overall quality of life for patients. I thought the next stage system was novel and interesting, and of course the opportunity to expand this for patients on a regular out basis, but also for patients in skilled nursing facilities. I thought it was a wonderful plan, a wonderful idea, and we've had great success in developing this as an opportunity, really and most remarkably in people with more advanced heart disease and the so-called cardiorenal syndrome, where patients have problems with both their heart and their kidneys. And this type of system is so much better tuned to provide better care for these types of patients. And it allows them fewer problems with volume overload so that there are lesser hospitalizations and again, overall better quality of life and patient-reported outcomes.
Matt, my next question is, so that we can try to, again, imagine it's all going to be edited, is about how long you've known John and Don, and if you want to just make it about me, but just sort of the relationship, and that way if we want to bring in anything about past history with
Sure.
you know what I mean, they knew the industry, that kind of stuff. We may not use it, but it's just why I'm asking. How long have you known John and Don?
I've known Mr. Haseman for probably close to 20 years. He has been very active in the community, having been one of the principals of the Porter Dialysis Unit program. He'd had a grandfather with chronic kidney disease. Mr. Haseman has also volunteered with the National Kidney Foundation for many years, as have I, so we've had an opportunity to work together, not professionally, but more for fundraising and for opportunities, raising awareness about kidney disease and obviously helping funding programs for both the patients as well as to do more research. It's been in the last few years I had a chance to meet Mr. Weir. We've been working together, putting together the ideas about developing a home dialysis program, both for outpatient home hemodialysis, but also home peritoneal dialysis, as well as the opportunity to provide these same types of services in skilled nursing facilities for probably more than 3 years now. And so it's been a very capable working relationship. We all have a different level of expertise. I think we interrelate well and have an opportunity to feed off one another in terms of developing an understanding about how to better improve overall patient care and perhaps most importantly, patient-reported outcomes.
Excellent. And I know you might have already answered this, but if you want to expand on it, what is your opinion about home modalities versus in-center hemo?
When one has to evaluate the opportunities with home modalities, either home hemodialysis or home peritoneal dialysis versus in-center hemodialysis, there really are substantial differences. The opportunities with home hemo or home PD is certainly the greater opportunity for flexibility, for adjusting the schedule and care plan so that it fits the demands of the lifestyle of the individual. This customization, I think, adds a lot to patient well-being, and in fact, probably also adds a lot in terms of overall health, although it's difficult to do studies to really compare in a randomized way how people do with home modalities versus in-center hemodialysis. But suffice it to say, the customization opportunity, I think, gives patients a better wherewithal that they are part of the program, that they can be in charge of their health and can take important steps to improving their overall opportunities to enjoy life, yet at the same time better take care of their kidney replacement therapy. Center hemodialysis does have an important place, but it's a much more tightly regimented approach to clinical care. You have set time frames for which your dialysis schedule is set. Often there is some degree of inflexibility about changing that, and so you are less capable of adjusting your approach to your kidney replacement therapy. If I had to do it myself, I would certainly try one of the home modalities first. The problem often is, though, that people are introduced to the in-center hemodialysis first, so they never get a full appreciation about the opportunities of home training and then ultimately being in charge of their own home care. Obviously, it's not for everybody, but for most people who are so motivated and have potential helpers who can assist them, it really does provide important flexibility and opportunity to better take charge of their overall health.
Fantastic.
What are some questions that a patient should ask their physician regarding that to see if they're interested in home dialysis? What are some of the important questions to ask?
Well, decisions about what type of home therapy is really up to the patient, the family, and working with the healthcare team. And I would say that the healthcare team very importantly includes not only the physician, but the nurse, the social worker, and of course the dietitian. We're a total team in terms of how we work with our patients. And each one of these types of skill sets is very important in organizing an appropriate healthcare plan. But much of the decisions are very much individual. Certainly there may also be medical issues which may play a role in our decision-making process. For example, people that have had multiple abdominal surgeries may not be adequate candidates for peritoneal dialysis. On the other hand, people with extensive vascular disease, for example, may not be an optimal candidate for hemodialysis where vascular access is necessary. And also, too, the home situation, who can help them, how often they're available. There's so many factors that come in to play a role in the decision-making process. It's really difficult to generalize. And what I always tell my patients, this is up to the individual. It really should be your choice, but taking into account our team's advice for you.
And however you feel comfortable talking about this, what makes Home Dialysis of Maryland different than other providers in your eyes?
The difference with home dialysis, I suspect, is that we have a much more personal approach to individualizing our care plans. We work as a team. Every patient is a person, not a number. We're not too large that personal care is not a key aspect of what we do every day. Most of my patients have access to me either with my phone number or with my email address. They certainly have the phone numbers and access to all of our nursing staff. We're always available for the patients, 24/7 by 365. There are no disconnects in that regard. There are no answering machines. People have access, and I think that's the main issue. And when they come to visit with us, it's a personal opportunity, it's a friendship, it's an alliance where we all work together to improve overall quality of care and vitality and hopefully longevity.
Do home modalities give dialysis patients a greater opportunity for successful transplant?
It's a tough question to say whether or not home modalities provide a better opportunity for transplantation. That's a much more difficult clinical trial to do. What I would say is, and I've been involved in our transplantation program for many years, is that the people who choose to do home dialysis, either peritoneal or hemodialysis, often are more motivated, often are more careful, often are the types of people who will do well with the types of complicated regimens that we sometimes require for kidney transplant recipients. There's a fair amount of follow-up, fair amount of medication, and these are the people that tend to do well. So I often tease our patients that our home program is the transplant waiting room. We uniformly refer all of our patients for transplantation. Clearly, this is the best opportunity for the vast majority of patients, both to improve longevity but also vitality. We strongly recommend kidney transplantation.
Can you speak a little bit about the Home Dialysis of Maryland skilled nursing facility program and why it has been a game changer for that patient population?
The real opportunity with providing on-site home hemodialysis, so to speak, in these skilled nursing facilities is that it lessens the need for transportation. Now, this is a lot of work for patients where they need to be bundled up, trundled down to a waiting ambulance, or they may wait an hour. They then get put in it, transferred to a facility where they may wait again before being transferred to a chair, dialyzed, being transferred back to a waiting van, again, hours in between. I mean, you may have a 3.5-hour dialysis treatment, but you may be gone for 10 hours by the time all the transportation and manipulation has been done. The other advantage really is that by getting 4 shortened treatments per week, there is less volume overload. There is a marked reduction in medications required, especially for blood pressure. Less medication, fewer side effects, improved well-being, better sense of being able to breathe. Many factors that play a role that facilitate the rehabilitation process and make people feel better, stronger, and capable to get out of the rehab center and then obviously back home again.
Excellent. With this question, I'm thinking about Diane McDougall. And the question is more, can you share a success story without names of someone that started in a SNF, proceeded home with that equipment, after training, of course, and then successfully liver kidney transplant? You think that we can talk about that?
Sure.
Okay.
The opportunity for patients to, in a sense, facilitate overall long-term improvement of care has been an exciting opportunity for us. I remember a lady who received a liver transplant after sustaining a fall, where she broke several bones and was in the hospital for many months after her liver transplant due to some medical complications and, of course, her orthopedic complications due to her bone fractures, who ultimately had to go to a rehab center. Because her kidneys had failed at the time of her liver transplant, she required dialytic therapy. We were able to maintain her at the skilled nursing facility on dialysis as she proceeded with her rehabilitation, and it was remarkable to see her improve. She subsequently was able to go home. We ultimately were able to get her listed for, and then subsequently she received a kidney transplant and has subsequently transitioned back into a normal life, so to speak. She still has some residual problems with her bones due to her prior fractures and injuries, but has made tremendous progress. It's this type of opportunity that really gives us the greatest thrill in seeing our patients improve in terms of their overall quality of life. And I could go on and on. We've had more than a half dozen patients who've received successful kidney and or kidney pancreas transplants just in the last 6 or 7 months, and all have progressed beautifully. And I might say the real advantage here is that the home systems that we utilized to facilitate their care in large part helped improve their overall health, their cardiac function, and I think in large part allowed them to be better subsequent transplant recipients.
Where do you feel the future of nephrology and dialysis are headed? Telemedicine, et cetera.
The future of renal replacement therapy ultimately is exciting. Hopefully there will be wearable artificial kidneys in the future. I think for right now, what's really happening are greater opportunities to facilitate simpler and more capable home hemodialysis or home peritoneal dialysis. The greater sophistication of the machines, the greater simplicity, the reduction in risk for patients doing home therapy are very, very important advantages, and I think these will be key. I think the other opportunity is facilitating the development of more donors, kidney donors that is, so that we'll have more of an opportunity for kidney transplantation. Unfortunately, we still have a great deficiency in the numbers of kidneys that are available for the people who are waiting on dialysis. And although dialytic therapies are improving, we still ultimately will need kidney transplantation for the majority of these patients.
If someone was told by their physician, let's say 10 years ago, that they were not eligible for home dialysis for a certain reason, you just mentioned the technology changing, etc. Versus 10 years ago, if that's far enough back versus now, is that reevaluated in some cases?
Well, the decisions about whether a person can be a home hemodialysis candidate, I don't think is as much based on the medical comorbidity as it is lifestyle, knowledge, and willingness, and certainly the family situation. I do think the one advantage that will be coming very soon is the opportunity for maintaining long-term catheter-based hemodialysis. There are many new catheters with antibiotic impregnation, which may allow greater safety. Now, that's one of the issues for home hemodialysis that's always been a little bit difficult, and that's the cannulation of the fistula or the graft. And it's been a limiting feature for some patients. So the development of these types of catheters, I think, will be a tremendous opportunity in that particular regard. Peritoneal dialysis still is an improving and evolving science as well, but we're limited by the capability of the peritoneal membrane. The development of newer types of solutions, which may be better and more biocompatible, may allow longer-term peritoneal dialysis for some patients. It may also facilitate better clearance, but they're still being studied, and I would have to say that the technology has improved sufficiently over the last several years that I think very few patients would be excluded from home remedies simply because the adequacy of technology is not there. It certainly is. I think what's far more important is their willingness to participate in the education process, their help at home, and again, the home situation. That's much more of an important issue.
How about the cleanliness of the facility? And I know this might not have been studied as much as it, as it's opinion based, but for a patient who's especially has a weakened immune system, are there advantages for them being on home dialysis versus going into a center where there could potentially be other illnesses present?
I'm not aware of any predispositions about center-based dialysis from an infection standpoint versus home. Obviously, there are many strict regulations about cleanliness, hand washing. There are many protocols in terms of storage, use, maintenance of machines and whatnot. I think sometimes if people are more susceptible to infection, I think it's fair to say that if there are other sick people on your dialysis shift, it's conceivably possible that you too may be a bit more vulnerable. But I would not say that that is a major limiting concern about center-based hemodialysis. I think really what's far more important is the ability to customize the treatment program to best suit your needs and better optimize your capabilities of better controlling volume and clearance and making you feel better and ultimately living longer.
A couple wrap-up questions, Matt. Can you tell us about your affiliation with the National Kidney Foundation?
Well, I've worked with the National Kidney Foundation for probably close to 30 years. It's a very important organization, both locally, our National Kidney Foundation of Maryland, our local affiliate, but as well as with national. I've been involved with both organizations for many, many years. I've served on the board of directors for our local affiliate for more than 25 years. I've also still on the medical advisory board. I also work with national on an annual basis at the annual meeting. I've worked with the KDOKI program. In fact, even this past week I gave the 20th annual KDOKI lecture at the National Kidney Foundation's annual spring clinical meeting. So I enjoy working with them. I think it's a very worthy cause. I encourage people to provide support either with their time or their resources or both, because it is singularly one of the most important organizations to provide support to patients as well as to facilitate research in the area of kidney disease.
Any parting words you'd like to offer patients and or their families?
My only parting words would be encouragement. Developing end-stage renal disease is tough on you from a psychological standpoint, in that it does require some readjustment of your lifestyle and what you need to do. But once that adjustment occurs, I think there's much to look forward to. There are these home treatment opportunities which really can limit any intrusion in terms of your lifestyle and how you feel. And ultimately our goal is to have everyone get a kidney transplant if that's at all possible.
That's a wrap.
Cool.